Hey guys, welcome back to another video. And in this video, we're going to be discussing paying your marketers for your home health agency, your home care company, your hospice agency properly. Okay, so let's have that discussion right now in this video. Okay, so now home health agencies have room to marketing their agencies to referral sources and also to the public. We need to be able to make sure we take care on how we create our pay structures for our liaisons and our marketers. So as marketing practices become more popular and is definitely needed, your agency should be trained and your management should be trained to orient your current marketing team, your liaisons, your salespeople out there. We need to make sure that they are trained properly so that they do not break any laws that causes problems or harm for your company. So as marketing practices become more popular, we are starting to see people hiring salespeople who have experience outside the arena of the healthcare industry. So these employees are good to bring in, but at the very same time as they are working for unregulated business environments, and they definitely need the education on the rules and the requirements that governs the healthcare industry. As home health owners, as administrators, director of nursing, CEOs, or even managers, many marketing techniques used in the outside business world, outside of the healthcare industry, can land a healthcare provider such as yourselves in hot waters, even into jail. To add to this, employment law requirements for minimum wage and overtime, specific rules. They set specific rules for those outside salespeople. And we definitely need to make sure that we completely adhere to them. Violations of any of these laws can be costly for your company. We are going to discuss several things about this area, okay? The first one we're going to talk about is the problems with paying for referrals, okay? Whether you title yourself a salesperson, a marketer, a liaison, when we bring in people outside of the healthcare industries, these salespeople and marketers from non-healthcare business fields, they traditionally receive their payments in the form of what we call a commission or a draw against commissions. In other words, they are pretty much paid or receive payment on the basis of the sales that they actually can produce. Now, in the healthcare industry, sales are generated through referrals from other healthcare providers or direct solicitation of the patients. In either way, in either case, there exists what a strict prohibition against any payments, any solicitation of payments, or receipt of payments for a referral of a Medicare or a Medicaid business. All right? Let's discuss this again. The Medicare and the Medicaid Anti-Kickback Act specifically prohibits whoever from knowingly and willingly soliciting or receiving any remuneration if one purpose of the payment is to induce a referral to the business reimbursed under the Medicare or the Medicaid program. This law therefore impacts how we pay your marketers for the referrals generated and also raises concerns about any traditional business perks your marketers may choose to offer the referral sources. So let's talk about that. You may be paying your marketers correctly under your eyes and from what you see, but if your marketers in the other end or in the back end of things is paying those referral sources, because the more that they get, the more they get to be able to keep their job or gain more income, more money, you are actually still violating the law. You need to make sure that you have policies and procedures in place of your company, as well as coaching time and in services, and that your marketers are actually signing a contract stating that they are aware of the anti-kickback statute and that they will never, ever do anything that will violate that. Now, similarly, the HIPAA law, or what we call the Health Insurance Portability and Accountability Act, also includes prohibition against the use of gifts as well as any other benefits to directly solicit any patients for services. Now, having these two laws can actually incur criminal penalties in jail sentences, huge fines, and mandatory exclusion from any government program participation. That's crazy, right? It is so clear that payment of a commission or even a sizable bonus to your liaisons, to your marketers, has an express and exclusive purpose of inducing a referral for home health business, much of which is reimbursed by the Medicare or Medicaid program. As such, right, those commission payments to your marketers will violate the plain word of the Anti-Kickback Act. And in addition, in the business world, salespeople often market to their prospective clients for lunches, for golf games, or any other perks out there. Those business tactics outside the healthcare industry cannot work inside this business, and we must let them know that. We must let them know the rules in our industry. All right? Now, moving on. Over here at the Home Health Success Academy, we can definitely help your company to be able to create a payment structure in order to be able to make sure that you are within the law, that you are not violating any law out there that could put you, your team, your company, your money in harm's way. Now, commission payments are protected. Employers should be concerned about and need also having their base alerted to certain areas that their marketers' sales practices on a day-to-day basis. When you hire someone, each of your employees should always be instructed on the prohibition of the Anti-Kickback Act. When I hire a new employee, right, that is one of the first thing that I will orientate them in regards to Anti-Kickback Act. And they are required to review and sign a code of conduct agreeing to not offer any kickbacks, yes, including the person that answers your call, yes, including your certified nursing assistant, yes, including your janitor for your company, your therapist. It doesn't matter who you hire, they all have to sign that conduct. They all should be able to agree that they will not offer any kickbacks to anyone out there. Now, it is unlikely that the OIG would prosecute you for a single lunch or box of donuts. The literal language of the Anti-Kickback Act prohibits such conduct, but at a minimum, this requirement establishes a pattern of supervision that should be supplemented with regular performance reviews and ongoing supervision of activities. Countless times, agency owners, CEOs, presidents of these home health agencies do not even know a single thing that their home health marketer, their liaison, their salesperson is doing out there in the field. You need to be able to make sure that you have someone monitoring them in a daily basis. That's what we do at Home Health Success Academy, is that we get hired by a lot of agencies that we monitor your team because ultimately they are the lifeblood of your company. They are the ones that's going to be bringing in the patients to your agency. If they don't bring these patients into your company, you will cease to exist. But at the very same time, you will cease to exist if they are bringing patients in the wrong way. You need to be able to be mindful of what is going on in your company, in the office, outside the office as well. Now, you need to be able to make sure, and it is very important to know that agencies should always scrutinize and identify any and all marketing costs, even including the way we pay our marketers, to make sure that no such costs are claimed in the annual cost report. Marketing costs are still unallowable in the cost report, and any claim for such costs could be constructed to be a false claim. Can you believe that? Another thing to look into when you are out there, right, hiring your marketing team and paying them, one of the biggest hurdles that you will face is structuring a marketing payment plan that will be considered, or it is considerable, or is in consideration of the requirements for the minimum wage and overtime liability, right? As a quick overview, employers should and must pay overtime to employees for all hours worked in a work week if there is an excess of 40 hours, unless the employee is a properly classified exempt employee. Overtime pay is to be calculated 1.5 times the employee's regular rate of pay. Hours worked includes all time an employee has either permitted to work, or including paperwork, includes travel time other than to and from the work site. The use of an approved only overtime policy is pointless and without effect if the employee's job duties requires him or her to work an excess of 40 hours a work week. So a commission payment system encourages marketers to be out in the field, pounding on the doors, knocking into these walls of these physicians, so they're going to be able to be going in and be able to get you guys more referrals. Thus, there exists a one risk of overtime pay, unless those marketers are properly assigned and classified into an exempt job duty status. So make sure that you look into, that you provide those, that you're actually able to classify them into an exempt job duty status. All right? Contact your lawyer, contact your accountant. Now, one of the biggest problems that I've faced, or I've heard, is how much do we pay our marketers? This is very tricky because it depends on where you are currently at. Where does your home health agency reside? Which state or which area of the country is it? So I don't really want to be able to give you a specific number, but I will go ahead and explain to you how I've done it in the past, okay? I've always made sure that I start my marketers, my liaisons at what we call a low tier. When you hire a new marketer, never give them the highest tier possible, because you don't even know how much or how they'll be able to produce for you in the field. I've made this mistake so many different times, and I don't make them anymore. So as you need to know, you need to see first what your marketers can do in the field, and then if they can prove themselves to do everything legally, to do everything properly, to be able to submit the forms needed, then you can determine if they are worth the higher rate. You need to first check within the first 3 months, and don't even make that mistake to give them the high rate automatically. Now, if you want to be able to create a structure for your payments, we have a free video online that you can watch in YouTube, or give us a call and we will definitely like to speak to you and help you more into this matter. Paying the marketers is an important thing. They have to be happy. If they're good producers, you want to do everything you can that you keep in your company, because if they're good at what they do, then guess what? That means your census will go up. If they're not good at what they do, that means your census will go down and you wasted time with them when you could have given it to another person who would have done a better job. So just give us a call, contact us. We definitely want to help you guys out. If you like this video, comment down below. Once again, thank you so much. And always remember, home health marketing is easy when you know what you're doing.